Hello and welcome. Today we are going deep, really deep, into one of the most overlooked yet absolutely critical systems in our entire body, the lymphatic system. Think of it as a hidden highway, constantly working in the background. We're going to talk about lymphedema, which is basically what happens when that highway gets a major traffic jam. We'll explore why this system is so important, what happens when it breaks down, and how it's shockingly connected to things like gout and arthritis. And of course, we'll get into how it's diagnosed and all the cutting-edge ways we're learning to manage it. So, buckle up, let's dive in. Okay, so here's our game plan for this journey. First, we'll explore the body's other river to get a handle on what this lymphatic system even is. Then, we'll see the messy reality of when drainage fails, using gout and arthritis as our case studies. After that, we're taking a magnifying glass inside the lymph node, the system's command center, and we'll meet the cellular gatekeepers who are running the show. And finally, the part you've been waiting for, rebooting the system, where we talk all about management, diet, and what the future of therapy looks like. It's going to be a fascinating ride. All right, let's kick things off with the big picture. I want you to imagine your body as this huge, sprawling metropolis. You've got roads, you've got power lines, but you also need a sophisticated sanitation department and a top-notch security force, right? Well, that's the lymphatic system. It's this incredible network of vessels and nodes that's always working, clearing out cellular junk, keeping fluid levels just right, and, maybe most importantly, acting as the superhighway for our immune cells. Honestly, it's the unsung hero of our entire internal world. And this image here really gives you a sense of how it all works. You see those tiny little green vessels weaving through the tissue? They're like microscopic vacuum cleaners, constantly pulling in excess fluid, which we call lymph. But here's the cool part. They're not just grabbing fluid. They're also picking up cellular debris, waste products, and, this is key, immune cells that have captured invaders. All of that stuff then gets shuttled to the lymph nodes, which are basically immune system HQs. It's where the battle plans are drawn up. Without this system, our body's defenses would be flying blind.
So it's this beautifully designed system, but what happens when the pipes get clogged, when the drainage fails? Well, you get chaos. And it's so much more than just the swelling we call lymphedema. It's a fundamental breakdown in the body's ability to take out the inflammatory trash. To really understand the consequences, we're going to look at two really painful examples where this goes wrong: gout and rheumatoid arthritis.
Let's talk about gout first. The whole problem starts with something called hyperuricemia, basically just way too much urate or uric acid floating around in your blood. When the body can't clear it out fast enough, it starts to form these tiny, sharp, needle-like crystals. And where do they go? They love to settle in our joints, creating this perfect storm for an incredibly painful attack. This is where the lymphatic system's failure is just devastating. It simply can't drain these inflammatory crystals away. And this is the most important part to understand. The uric acid buildup forming crystals is the primary cause of inflammation, causing gout. It's actually not the crystals themselves that create all that agony. It's our own body's over-the-top reaction to them. Our immune system spots these crystals and goes into full-blown panic mode, thinking there's some dangerous foreign invader. It launches this massive attack, and that friendly fire is what causes the intense, searing pain and swelling. It's a classic case of the immune response causing more damage than the actual problem. Now, for the longest time, doctors kind of had a guess that these crystals were there. But check this out. We now have technology that lets us see them in plain sight. It's called dual energy computed tomography, or DECT for short. It's incredible. It makes the urate crystal deposits literally light up in these bright color-coded images. This is a total game changer, not just for diagnosing gout, but for watching treatments work in real time as they dissolve the crystals. Just think about the possibilities if we could see lymphatic blockages with this kind of clarity. That's where the science is headed. That's a great point. And the story gets even more layered when we connect it to rheumatoid arthritis. When we look at animal models, in this case mice that are engineered to develop arthritis, we see a clear breakdown in the lymphatic system. Their lymphatic vessels get all weird, they're wider, they have fewer branches, they're just not good at drainage. But here's a fascinating twist. When researchers looked at human patients with rheumatoid arthritis, they saw a similar drainage delay, but for a different reason. The actual pumping action of their vessels seemed to be okay. It's a subtle but crucial difference that reminds us that while animal models are a great starting point, there's no substitute for studying these conditions directly in people. And this brings us to a really common and frankly tricky point. You hear this all the time. Your personal diet and behavior is the primary driver of the lymphedema. But here's where we need to add a little nuance. While lifestyle is definitely important, the science, especially for a condition like gout, tells a much more complex story.
Research is pretty clear that genetics and things like obesity can be massive drivers. I mean, one study found that obesity alone could be responsible for almost half the risk for high uric acid. That's why diet alone often isn't enough, and why medication is usually the first-line treatment. Diet becomes a really powerful, supportive tool, but it's not always the root cause. It's about a multi-pronged attack. Okay, so we've been cruising down the lymphatic highways. Now it's time to pull over and take a tour of the command centers themselves, the lymph nodes. And I need you to forget any idea of these being just passive filters. No way. These are dynamic, bustling headquarters where our immune system is making some of its most important life or death decisions.
And this is where my mind is just blown by the latest science. Using new technology, we've discovered something amazing about the very cells that line the lymphatic plumbing. They're called LECs. We used to think they were all basically the same generic pipelining cells. We couldn't have been more wrong. It's like a city full of specialists. You've got floor and ceiling cells that act as the receiving docks. You've got other cells that are basically bouncers managing the exit doors. And then you have some that are active players, literally telling T cells what to do and what to ignore. It's an insane level of organization that we're just now starting to understand.
So what does this all mean? Well, this discovery of specialized LECs completely flips the script on how we view the lymphatic system. It is not just a passive drainage system. The cells that form the walls of these vessels are active, intelligent gatekeepers. They're constantly talking to immune cells, shaping the conversation, and directly regulating the entire immune response. And here's a perfect example of what I'm talking about. So you have an immune scout, a dendritic cell, that's found something suspicious and needs to get to the lymph node to sound the alarm. It doesn't just barge in. No, it has to engage in a very specific molecular handshake with the LECs on the vessel wall. These LECs are the gatekeepers. They control who gets in and when, which is a super important way the body fine-tunes the immune response and prevents it from overreacting to every little thing. And if you thought that was cool, hold on, it gets even better. These LECs aren't just gatekeepers, they are also sophisticated little chemical factories. This is one of my favorite discoveries. They can actually take an amino acid, tryptophan, yep, the one you hear about in turkey, and transform it into a powerful anti-inflammatory molecule. This new molecule then goes out and tells other, more aggressive immune cells to chill out. So the very walls of the immune system's highway have a built-in braking system. It's a genius way to maintain peace and prevent autoimmunity. So when you see how these incredibly smart gatekeeping cells and these little biochemical factories are supposed to work, it suddenly becomes crystal clear why the basic stuff matters so much. Here's the bottom line. Your diet, hydration, and exercise drives lymphatic system and health. And that's not just some generic wellness advice. It's because these simple things provide the fuel, the fluid, and the physical push, the muscle contractions, that this entire intricate system needs to do its job properly. It's what allows it to drain waste, communicate effectively, and keep that delicate immune balance we've been talking about. Okay, this all brings us to the most important part of our whole conversation. We've seen how the system works, we've seen its weak spots, so the big question is, what can we do about it? How can we actually intervene and help reboot the system when it's failing? And what amazing things are on the horizon for treating these diseases? This is it. This is the question that's on the minds of millions of people every single day. How can lymphedema be managed? And really, the same question applies to the lymphatic issues we see in gout and arthritis. And the answer isn't some magic pill. It's a smart, comprehensive strategy that hits the problem from multiple angles, addressing both the symptoms and the root cause. And for gout, at least, we have a very clear evidence-based playbook. The American College of Rheumatology strongly recommends what's called a treat-to-target strategy. It's simple, really. The goal is to use medication, most commonly allopurinol, to actively drive the patient's urate level down below 6 milligrams per deciliter. Why that number? Because that's the magic threshold where those painful crystals physically start to dissolve. It's a great model for how to think about these problems. Identify the core issue, the crystals, and then attack it with a targeted, measurable strategy. So, beyond medications, we have to ask, what are key elements for lymphedema drainage through by diet, hydration, and massage? These are really the cornerstones of hands-on lymphedema care. Think of it like this. Proper hydration makes sure the lymph fluid isn't too thick and can actually flow. A smart, anti-inflammatory diet reduces the overall burden on the system. And then specialized techniques like manual lymphatic drainage, that's the massage part, act as an external pump, physically and gently helping to move that stuck fluid out of congested areas. And you know, this naturally leads us to an even bigger, more powerful question.
Thinking about everything we've learned today, can we manage and reduce inflammation by diet and hydration? And the answer from the scientific community is an increasingly loud yes. When you eat a diet packed with whole foods, antioxidants, and you stay properly hydrated, you're not just helping one thing, you are supporting every single function of your lymphatic system. You're literally creating an internal environment where your body can find balance, instead of one that fuels the fire of chronic inflammation.
So let's tie this all together with the most important takeaway of the day. And it's this. Thoughtful management of diet, hydration with whole foods, and clean water is key to managing lymphedema and avoiding gout. It's never about just one thing. It's a holistic approach. It's about combining smart medical treatments with these fundamental lifestyle pillars. Supporting your lymphatic system is not an optional extra. It is a core part of taking back control of your health so that your body's hidden highway can do its job and keep you healthy. And finally, let's take a quick peek over the horizon, because the science here is just moving at lightning speed. Researchers are now developing these incredible new ways to deliver factors that literally encourage the body to grow new lymphatic vessels. They're using the same kind of lipid nanoparticle technology you heard about with mRNA vaccines to deliver these growth factors right to the spot where they're needed. We're moving beyond just managing the problem and toward a future where we might actually be able to repair and rebuild the system. It's truly cutting-edge stuff. So we'll leave you with this final massive thought to chew on. We've traveled down this hidden highway, we've seen how it works, how it breaks, and how we're learning to fix it. So if this one system is so absolutely central to controlling inflammation and telling the immune system when to stand down, could mastering it be the key to controlling autoimmune disease? It's a huge question, but as we keep unlocking the secrets of this amazing system, the answer could literally change the future of medicine. Thanks so much for joining us on this exploration.